am still really sad about this Luke Perry development. We now know that he has passed away of a massive stroke. He's 52 years old. Talked about this a little bit at the top of the show, and you guys shared your near-death experiences with me. Obviously, Mr. Perry, he's gone from us now. He had a massive stroke, but he's a young man. He's 52 years old. That often gives us pause. For the rest of us who grew up watching him or are of this generation, we think, oh my goodness, it really smacks of our humanity. Going, well, it could all end for me tomorrow also. Luke Perry was having a revival of his career. He was on Riverdale. And was seemingly, in decent health. He was thin. I mean, we don't know, obviously, his medical records. But it makes you think, oh my gosh, this could happen to me. What would I do? What am I going to change? How am I going to change my life? Be a better person? All of that stuff. I always want to hear if you've had a good story, if you've had a near-death experience, call in and tell me. But I specifically want to talk about stroke right now because we hear that Luke Perry had a massive stroke. He was surrounded by his children and his wife when he passed away. Of course, the family asked for privacy, but we're thinking, oh my gosh, a stroke. How could this possibly happen to a 52-year-old man? Dr. Ron Tarrel is joining me. He is a neurologist with Noran Neurological Clinic at Abbott Northwestern. Dr. Tarrel, welcome to the program.
Hi, happy to be here.
Okay, 52 years old, massive stroke. Is this common?
It is not uncommon. We tend to think of stroke as an illness that only affects the elderly. But stroke is really about the risk factors that lead to it. High blood pressure, diabetes, high cholesterol, sometimes genetics, but it can happen to infants, teenagers, young adults, middle-aged, and elderly as well.
Okay, so it's my understanding that a stroke is a blood clot that goes to your brain and sort of, does the blood clot then explode? What happens there? Does it block something?
Well, 85 to 90% of all clots, of all strokes are blood clots. And blood clots can grow in small blood vessels related to people with high blood pressure, diabetes, sometimes just vascular disease related to their genetics. Clots can also grow in large blood vessels, people who have hardening of the arteries, atherosclerosis, which is cholesterol is a big risk factor for. That's another mechanism. The other mechanism is that clots can travel up from the heart. Some people have abnormal rhythms of the heart that do that, or poor valves in the heart that clots can form on and then travel up. But the other 10 to 15% of strokes I didn't talk about are the hemorrhagic strokes. Those are the bleeding kind of strokes that can be caused by hypertension, or people are familiar with the idea of having an aneurysm, a weakened part of the wall of a blood vessel, and that can rupture and causes blood into the coverings of the brain or into the brain itself. That could very well be. We don't know. And he could have had a huge blood clot that caused a very large stroke affecting a huge area of the brain that caused Mr. Perry to pass away. But then again, he could have had a huge bleeding kind of stroke, which is, these are two different animals we're talking about, but we refer to both of them as stroke.
But it's also not something that you can prevent. That no matter how healthy you are, how well you eat, how thin you are, you don't smoke, is that something that you can prevent, or is that just a ticking time bomb in anyone's brain?
Stroke is a preventable illness. It's preventable either side of that, either the bleeding kind of stroke or the far more common clotting kind of stroke. It can be prevented. And it is about lifestyle. It's about living a healthy lifestyle. Exercise and good diet are by far and away the most important things we could do for ourselves in almost any instance for all of our general health. But also, if you do happen to have maybe a family history of high blood pressure, or you find that you're prone to high cholesterol, heart disease, these things can be managed. And by managing those underlying diseases, you're minimizing the risk of developing stroke, the clots that cause stroke, and possibly even the bleeding that can lead to stroke as well.
Are men and women equally at risk?
They're generally equally at risk. More men have strokes than women. The age differences show up a little bit when you look at populations of people. It happens differently at a different rate in different ethnicities, but everybody can have a stroke. And again, that includes the young and the old.
Now, Is there a way to screen for this? Because you said, if you have a high risk of high blood pressure or obesity or some of the other risk factors that you mentioned, is there a screening that can be done to see?
There is. There are screenings that are done in the community. There are screenings that your doctor, would do if you have regular checkups, which is another very good thing to do. And the screening is, once again, screening for underlying risk factors. Doctors will take your blood pressure every time you go in for a clinic visit. If you're going in for an annual history and physical, they'll usually do an EKG looking at your heart rhythms. Mm-hmm. They may do other testing based on family history or any other coincident diseases that you may have. So they can look at those things, and that's why we need to treat those things. We can't take a lot of that for granted. A lot of people, don't want to bother with pills. They think there's a lot of side effects, and of course that can be the case. But pills also work, and blood pressure medicine, for example, if you take the medications and lower your blood pressure, there is a measurably decreased risk of having a stroke or a heart attack. And that's true across a lot of these different kinds of illnesses that can be risk factors for stroke and heart attack.
Speaking with Dr. Ron Tarrel, he's a neurologist with the Noran Neurological Clinic at Abbott Northwestern Hospital. Doc, we have a few minutes left. Now, it's my understanding treatment of stroke is really important when it comes to timing. And also describe when you're having a stroke, what does that feel like and how important it is in a certain amount of time to get help?
Thank you for asking the best questions you could possibly ask. The most important thing to recognize is what a stroke looks like when it happens, what the warning signs are. And we have this little acronym that we use that's been going around for several years with the American Heart Association and everything, but we've refined it. Have to remember, and I'm talking about us in the community walking around, is the acronym BFAST. BEFAST. Okay. The B stands for balance or coordination. The E stands for eyes, meaning eye movement or vision. The F is for face, meaning that you can have facial weakness that becomes visible to people around you. The A is for arm. It can be arm or leg weakness, any kind of limb weakness. The S is for changes in your speech or language. And the T is for time. So stroke doesn't cause pain most of the time. The bleeding kind of strokes sometimes can cause a terrible headache. But the other kind of strokes, the far more common clotting kind of strokes, it's usually not about pain. You lose function, and it happens suddenly. So when a clot blocks a blood vessel, whatever part of the brain doesn't get its blood supply, whatever part of the body it controls goes out on you. So if you suddenly have a sense of weakness in your left arm and left leg, it's not about pain, and that's why people tend not to take it too seriously at first. But you can't wait. You have to. That's a reason to call 911 right there. That BFAST acronym and those different changes in balance in your vision and facial strength and movement, your ability to use language. As soon as you lose that, that's a stroke till proven otherwise, and you've got to get to a doctor because the treatments we have can reverse the stroke specifically, meaning it can dissolve the blood clots that form the blockage in the vessels and allow blood to return to that area of the brain before there's permanent damage. But we only have a few hours to get to that. We can't use it after too much time has passed. So again, you don't call your doctor's office. You don't even ask your wife to drive you in. You call 911 and you have to get to the nearest hospital as soon as possible for an evaluation. From there, they can determine whether you're likely having a stroke or not. They can do preliminary CT scan or a preliminary exam. They can contact us at major stroke centers like Abbott Northwestern, and we actually have telehealth, an ability to connect with outside hospitals where I can actually examine the patient on a camera from here to there and get them the treatment they need either at the hospital they're at, or if they need something a little more aggressive, we have that at the major stroke centers, of which Abbott Northwestern and other hospitals in the cities are. And that's really important. Again, if you don't get there in time, you miss that opportunity.
That's right. Thank you for that warning and for the information. Dr. Ron Tarrel, a neurologist with Noran Neurological Clinic at Abbott Northwestern Hospital. Dr. Tarrel, we thank you so much again for the work you're doing.
My pleasure.
You got it.